Good day, I am Shalame Tordio and I'm going to perform the Leopold's maneuver as well as the measuring of the Fundic height of the pregnant woman. So first things first is gather all the materials needed. So rolled towel, tape measure for measuring the Fundic height, and a stethoscope and small pillow. So next is provide privacy for the patient. So close. Provide dignity. Then introduce yourself. So, hi, I am Shalame Tudio. I am your student midwife. So I'm going to do the Leopold's maneuver, and it has 4 maneuver or 4 grips, and it is important for us to know the fetal presentation and fetal line of the baby inside your womb. So is that okay, ma'am? Okay, so instruct the mother to empty her bladder. So before we start, ma'am, do you want to urinate or defecate? To avoid disturbances when we do the procedure and there's no discomfort. Okay, ma'am, so do the proper hand washing technique to avoid contamination and do sanitation. So next is place the woman in a dorsal recumbent position, supine with knees flexed to relax abdominal muscle. Okay, then place the rolled towel in the waist to support so that it will not cause any supine hypotension syndrome. Then now we're going to expose the belly or the abdomen. Okay, so first I'm going to start with measuring the Fundic height of the pregnant woman. So when we measure the Fundic height, okay, so we should first palpate the abdomen or the which part is the solid. So we should not put in our mind that when doing the Fundic height, we're going to start at the xiphoid process. So the proper way is to palpate first which part is hard. Okay, so I feel here. So now I'm going to start. Okay, starting from the Symphysis pubis. So okay, cm. Okay. So her Fundic height is 16 cm. So the Fundic height of the pregnant woman is 16 cm. Okay, so now I'm going to proceed to Leopold's maneuver. Okay, so before doing the Leopold's maneuver, so I will explain what is it. So it is an abdominal examination or abdominal palpation of pregnant women, or Leopold's maneuver is preferably performed after 24 weeks gestation when fetal outline can already be palpated. Okay, so drape properly. So we're done instructing the pregnant woman to empty her bladder. So I'm done also explaining what is Leopold's maneuver. So before we touch the mother's abdomen, we should warm our hands first so that our patient will not be shocked. Okay, so one hands first by rubbing them together before placing them over the woman's abdomen. So cold hands may stimulate uterine contractions. So that what is the reason why we should warm our hands first. So use the palm for palpation and not the fingers. So there are 4 grips. So the first maneuver is the Fundal grip, the triangular, then the umbilical grip, the pelvic grip, and the pollex grip. So first maneuver or first grip is the purpose is to determine fetal part lying in the fundus and to determine the presentation. So the procedure is using both hands, feel for the fetal part lying in the fundus. Okay, so like this. So if the nurse or the midwife feels the head which is round, smooth, with transverse groove of the neck, the fetus is in the breech presentation. And if the nurse midwife feel the buttocks which is soft and angular, it means the fetus is in vertex position. Okay, so like this. So next is the umbilical grip, and the purpose of this is to identify location of fetal back and to determine the position. Okay, so the procedure is one hand is used to steady the uterus on the one side of the abdomen, while the other moves slightly on a circular motion from top to the lower segment of the uterus to feel the fetal back and small fetal parts. Use gently but deep pressure. So this is for steady. So this is my hand to palpate. So from the top to lower. Okay, so small fetal parts feel nodular with numerous angular nodulations. So the fetal back feels smooth, hard, like a resistant plane. So next is this is the one called steady, and this is my hand to move to palpate. So from top to bottom. Okay, so now we're going to do the third maneuver, which is the pollex grip. So the purpose of this is to determine the degree of flexion of fetal head and also to determine the attitude or habitus. So the procedure would be facing foot part of the woman, then palpate fetal head downward about 2 inches above the inguinal ligament. Use both hands. So face the foot part of the patient. Then do like this. Palpate. So the findings would be, if descended deeply, only a small portion of the fetal head will be palpated. And if cephalic prominence or brow of the baby is on the same side of the small fetal parts, the head is flexed. And if cephalic prominence is on the same side of the fetal back, the head is extended. Okay, so that is the pollex grip. So the fourth maneuver is the pelvic grip. So the purpose of this is to determine engagement of presenting part. So the procedure is using the thumb and the finger, grasp the lower portion of the abdomen above symphysis pubis, press in slightly and make gentle movements from side to side. So the findings is the presenting part is engaged if it is not movable, and it is not yet engaged if it is still movable from side to side. So after doing the Leopold's maneuver, make sure to make your patient comfortable. Document all the procedures, and that's how you do the Leopold's maneuver. Thank you.